The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host today, Otto Los. Otto is a longtime volunteer, supporter, friend, all around A-plus senior
Morning,
at Project
Kristina.
Independence. It's good to be back with you, Otto. It's been a while.
It has been
I'm glad we're back. And this morning we are talking with Nirvaarni Mathoera, who is the Director of Health Insurance Programs for the Hospital Council, and we're talking about the Nassau-Suffolk Hospital Council Health Insurance Enrollment Assistance. Welcome, Nirvaarni.
Thank you. Good morning. Thanks for having me.
I'm glad to have you. So we, have been, together off air, and we had so many questions. So we're holding it all for air, and I know Otto is just waiting to dive in.
It's always interesting to just talk about who is the Nassau-Suffolk Hospital Council and who supports that.
Yeah.
How does it?
Yeah, sure. So to my understanding, Nassau-Suffolk Hospital Council, it's an entity that falls under Healthcare Association of New York State, Haney's. And their main office is in Rensselaer, New York, upstate New York. So we're considered, I guess, their Long Island chapter. So the primary role of NSHC is to work with hospitals to keep them sustainable on Long Island. So my supervisor, my COO, my CEO, and their team, they work a lot with hospitals to kind of work with their executives, understand their needs and take it back to upstate, advocate on their behalf, and just serve as the go-in-between to keep them functioning. So one of the gaps that they found many, many years ago was just the discrepancy with health insurance. So in response to that, they applied for this grant called the Community Assistance Age, Blind, and Disabled Grant with the New York State Department of Health, and they were awarded it. So essentially what this grant does is that we hire and train individuals to work with age, blind, disabled populations to get them educated about insurance, health insurances, advocate for them for health insurance, and enroll them, help them to complete the application for health insurance. And this specifically relates to public health insurances, Medicaid, and some of the New York State of Health insurance programs as well.
So how would this differ from something that we've talked about here, high cap?
Sure. So high cap focuses predominantly on Medicare.
Right.
And we focus on Medicaid and New York State of Health applications.
Okay.
Yeah.
And the hospitals, who financially supports the program?
New York State of Health. So it's a
Okay.
grant that we apply for every 5 years.
And it's a nonprofit.
It's a
We're
nonprofit.
not here to make money for an
No.
organization.
No. So yeah, we have very strict guidelines that we have to abide with by New York State Department of Health. And every month we submit a report to them about what we're doing, where we're going, who we're seeing. Of course, we maintain consumers' privacy, so the consumers' information aren't shared. We follow HIPAA guidelines, but we do have to report to the state about the number of consumers that we're serving.
I think an important thing here is that you're not here to sell anything, which is, basically what we're talking about is just knowledge and education, without the end goal of
And it's a free service.
selling something,
Yeah.
basically.
Absolutely. I mean, our enrollers go out into the community because, as you both know, Long Island is wide and vast, and not a lot of folks can get 5 miles down the road as easily. Right. So we try to spread ourselves as wide as we can so we can reach those consumers. And in addition to going to the sites that we do in the community, and just for reference, we currently have 48 sites. And so we're out and we're engaging with consumers. And a lot of times we don't complete applications the very first meeting with our consumers because it's a scary time for everyone to navigate, and trust and believe in the things that you're saying. So everyone is doing their due diligence. So when our enrollers go out there, they're spending a lot of time just building rapport and educating consumers about the programs and services available. And then it's really up to you if you want to then schedule an appointment with us for us to take it to the next step.
Well, that's good to know. And I think, also, because, you see these events and when you're applying for these things, you got to gather a lot of things too. So it's probably good. You get your initial kind of idea of what's necessary. and then get that all done. And how long does it actually take? So once you get like the ball rolling, right? Like how long should like a senior expect, if they do qualify for Medicaid and stuff like that, it would actually start kicking in for them?
So yeah, it depends on the individual circumstances. So we have some consumers that are very ill
Yeah.
or have, immediate needs. And then in those particular cases, we work very closely with that consumer's medical provider, so we can get them on health insurance within a month and a half.
Oh.
Right? That is not the typical
Right,
scenario,
right.
however, I will say.
Yeah.
Standard Medicaid application can take upwards of 60 to 90
Right,
days
that's-
for you to get a response from DSS.
Mhm.
Yeah.
Now, somebody used the words getting the ball rolling. Let's go back to how do you get the ball rolling?
Absolutely.
How do you start?
Yeah.
Yeah.
So there's a differentiation, and there's a reason why some folks can apply for health insurance in a New York State marketplace, and then there's some that cannot, right?
Okay.
So if you've been deemed age, which is 65 and older, or if you're disabled by the state, or if you're blind, then your Medicaid application is not processed through the marketplace. There's a different application that's done in person. It's a paper application, good old fashioned writing it in, filling it out, and sending it in. So let's say I've met you, Otto, at a library. We've talked about what your needs are. I tell you this is what you need. I give you our checklist,
Right.
which is like a state checklist. It's not mine or yours, Christine, for example. So then you review this, you ask me any questions you have. We understand what proofs it is that you need to submit to me. We get together, we complete this application. My obligation as a facilitated enroller is to submit this application to the Department of Social Services within 10 days. That allows you to provide me with any missing documentation so we can submit it. Once we've sent it to DSS gets back to us if there's any missing documentation. And because I'm listed as your facilitated enroller, whatever notices you're getting at home, I'm also getting at my business as well.
Right.
So then you and I talk. I say, hey, Otto, I just got this communication from your caseworker. We need last month's bank statements. We need a copy of your trust. We need a copy of whatever the missing information is. And they generally give us like a time frame for which the missing information needs to be submitted. So as long as we're in compliance with what's being asked, it moves along. But obviously, there are many things that happens, right?
But primarily it's 65 and over.
Yeah.
Market is not market, but group of
Consumers,
people
yeah.
who you're dealing with.
Unless you're disabled, and
Right.
of
Or
course,
you're blind.
yeah.
But
Yeah.
otherwise, if you are not disabled or
Yeah.
blind, you have to be 65 years old to be able to take advantage of, which is free, frankly,
Yeah.
service
You're right.
of getting you either real health insurance or Medicaid, I guess, either or both.
Yeah.
Right.
So in addition to Medicaid and New York State of Health insurance programs, I just want to differentiate a little bit, right?
Right.
So consumers less than 65, let's say a young man, 19 years old to 64 years old, he would apply through New York State of Health for health insurance. That's just the way they have it set up. I believe there's some works to kind of get the aged, blind, and disabled population to also complete their application online. But let's be honest.
It's hard, right?
It's hard.
Yeah.
It's hard. The paper application is hard. Much just navigating this online,
Right.
it's somewhat of a challenge as well. So the need for someone to be there to kind of like educate you about why is this question relevant? Why are they asking for my burial arrangement? Why are, just so we can honestly tell you,
Right.
this is why it's required. So you have a sense of security, knowing that you're not being scammed or your space is not being violated, right? So the New York State of Health, we generally can advise consumers to kind of go there and do their online applications. For those that are confused, we can also help them to do that application as well. But our primary focus is really on the aged, blind, and disabled population.
Right.
Right.
So I saw the phrase a community health advocate.
Yes, yes.
Clarify that.
Absolutely. So in addition to having this grant or primary grant from New York State Department of Health, we also have a small grant from Community Service Society of New York. They're an entity located in New York City. And they work with organizations across New York State, not just on Long Island, but in the city, but upstate New York as well, to educate us on current healthcare laws and rules So we can help consumers advocate for healthcare.
Oh.
So for example, let's say someone was hospitalized for an emergency, um, becomes discharged, gets home, and a few months later, they're receiving medical bills. I have parents that are in their late 60s and they've held professional gigs, and they'll say to me, "What is this?
Yeah.
Right.
What is
Mhm.
this?" And if you try calling the billing department of a hospital, it's not exactly the easiest thing to navigate, asking them, "Why am I getting this? What is this referring to? I have insurance. Why am I getting this?" So then, as a community health advocate, I work with you and I say, let me help you to figure this out, and we take our time to reach out to the hospitals and like let them know this is what this consumer has and this is what they should realistically be billed for. And then why are they getting this? And through this understanding that we are a community health advocate and we have some exposure to the current healthcare laws, they're more likely to work with us,
Mhm.
right? And so we can help to get those things resolved.
So this
that's great.
explanation of benefits that we receive from Medicare or your Medigap insurance or whatever, if it looks a little like you have some questions about it,
Call
it's
us.
something you would get involved
Yeah.
with.
Yes.
Okay. And one of the areas there that's interesting is a lot of times they're trying to encourage electronic receiving, paperless
Yeah.
receipt of explanation of benefits, which for some seniors is a complication because they're technologically not up to speed. But if they are, I think there's a tendency not to look at the explanation of benefits because you get, 128 emails
Yeah.
in 2
Right.
days, one of which is explanation of benefits, and then you have to log in and go to the site. And I think a lot of people don't bother doing that. And I include myself in that.
Yeah.
Yeah.
Unless you get a bill that says
Right. That you need to pay. You
you
owe
owe
this.
money,
Right.
which I
Yeah.
just had, was a little story
Mhm.
about
Yeah.
that.
Mm-hmm.
But learned that it had to do with my deductible, which, that's a legitimate cause. But
Mm-hmm.
some people might have a problem, and I was able to chop through that, but some people might not be able to.
Yeah, yeah. And it's not sticking the blame to hospitals or to billing companies. It's just the system,
Yeah, that's
It's
how it
not
works, right?
it's not the easiest thing to navigate. It's really not. I mean, for me, it's not. For someone that has no understanding, I imagine it's
Right.
it's probably not as well. And I will say this so that it doesn't seem like I'm just promoting my organization. Community Service Society, they work with several entities across Long Island as well. So we're not the only agency that provides this type of work at no cost. So there recently was a push to have Community Service Society's phone number listed on the explanation of benefits of your health insurance statement, I think in the back, so that if you needed clarification on this, the information is listed there for you to reach out to them so they can connect you with a local advocate to work through these.
So you just said
Notice.
something that.
So is that thing that actually they will do or
Yeah.
they have done? So is that number is on the?
Yeah, the number's there. It's on private insurance explanation of benefit, and then it's just been listed on Medicaid
Oh, wow. Yeah,
explanation of
that's
benefits
great.
too.
So you just said something that there's multiple options, all right, which makes it frankly a little more complicated
Mhm.
because now I, as a senior, say, well, where do I start? And I think my view is your organization now, if we know who it is, that'd be a place to start, as opposed to trying to, search around and look for the other organizations.
Yeah,
You have to
absolutely.
start somewhere is what I'm getting at.
Yeah, no, I mean, listen, we welcome consumers. We understand that it's a complicated system to navigate. Um, so reach out to us and we'll help you to navigate it.
And what's the contact number? Because I want to give that a bunch of times throughout.
Sure. I'm gonna give it to you directly. That's not it.
Yeah,
wanna
well, I
make
mean,
sure I'm
whatever
giving
you
the right-
find.
yeah,
Yes.
I'll give you the direct
Because
one,
they
yeah.
definitely and with this community health advocate, I know you said that's a grant. So is that something that you guys tend to always have? This like community health advocate for the health insurance in general? Is
We
that
have to apply for it every couple of years.
okay?
Yeah.
But it's something that
Yeah.
is usually okay. That's great.
Yeah, I have the number when you're ready
Yeah,
for it.
sure.
It's 631-435-3000.
3000.
Yeah.
Okay, great. Great. So once again, anyone listening out there, it's 631-435-3000.
Yeah,
Now, do you also have a website?
we do have a website. It's Nassau-Suffolk Hospital Council.
Great. Nassau-Suffolk Hospital Council. All right, wonderful. And I just think, it's so important and I just love that, as I'm looking through and just the billing issues. Oh my gosh, I just got the high sign. I'm all thrown off here. After the break, we will continue talking with Nirvaarni Mathoera, who is the Director of Health Insurance Programs for the Hospital Council, about Nassau-Suffolk Hospital Council Health Insurance Enrollment Assistance. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Lowe's. We're going to jump right back in with Nirvaarni Mathoera, who is the Director of Health Insurance Programs for the Hospital Council, all about the Nassau-Suffolk Hospital Council Health Insurance Enrollment Assistance. So let's jump back in. Otto, I know you had a question ready to go.
Well, just a general overview type question. I'm aware that your, Nassau-Suffolk Hospital Council, we're here to talk about your specific area, which is insurance, but I think it's good for people to know that there are other things that this organization could provide. So maybe just give a little bit of a top view.
Yeah, so like I mentioned earlier, they do a lot of advocacy work regarding hospitals. But I know that another grant that they have is kind of like community linkage services. So they work with other nonprofit organizations to better understand access to health in Long Island.
Right.
But really, in terms of like consumer direct services, I think our program predominantly would be what it is for access of health insurance, community health advocates. And I know we mentioned while off on our break about helping consumers to really like reach medical providers or find medical providers, which is something that as a community health advocate, we can help consumers to do as well.
So now let's go back to then your department.
Yeah.
Basically, there's two areas as I see it: insurance, general, like,
Yeah.
you need health insurance of some kind. And then perhaps you're able to also get Medicaid.
Yeah.
In other words, you could do one or the other.
Right.
Let's just take the general insurance. Like, what would be part one of that? Like, we get in touch with you, I talk to you, and I say, Nirvaarni, how do I get insurance? I'm having a problem.
Yeah.
I'm assuming that people have a problem either getting it or understanding how to get it.
Right. It's definitely a problem understanding how to get it, because New York State of Health is set up where you can complete your health insurance application online by yourself. You don't really need me or my colleagues to do it, but it's complicated system again, and then there's some questions that folks aren't really sure how to navigate. So my enrollers or my certified assistant counselor speaks to these consumers and tells them, based on their preliminary information that they've provided, some type of services they might be eligible for. And then once the proofs have been made available, we sit with that consumer, and my navigators help them to complete the applications online and submit everything. The difference with New York State of Health compared to the age blind disabled application or the supplement A application is that you generally get a response right away from New York State of Health. So if you and I sat today and we did that application, you'd know the end of the application if you've been approved for it or not. If you had a premium to pay, you'd know there like what your premium would be. My assistant counselors would sit with you then after you've been approved to help you to then choose a plan that works for you, right? So we don't influence you to say, go with Fidelis or go with Cigna. That's not really our role. We're really not able
You
to
show
do
them
that.
their options.
Yes, exactly. So I'll say to you, Otto, if you've historically gone to an orthopedic provider or you've gone to an endocrinologist, I want to know if this plan has your provider in network. So then we'll work with you to figure that out to make sure the plan that you're choosing, if you wanted to keep your current provider, that would work for you.
So you're basically
Kind of like working
talking about
backwards.
my needs.
Yes.
And frankly, as I see it, there's several categories of people I think you can get involved
Yeah,
with.
absolutely.
One of which, let's start just with the top line. They're either capable of doing something online or they're not. And if they're not capable of doing something online, which a lot of older people may not be, they could get involved with you because you can support them on the online part of it. Part two of it is really people have to have the the ability to kind of cut through finding out what does fit their needs. And if they have that ability themselves, fine. Some people will have the ability to do all of that.
Yeah.
But then if they are a little shaky on that, either one of those two, that's where you would fit as I see it, right?
Yeah, absolutely. And I mean, for consumers younger than 65, we helped this particular woman. I believe she was in her early 40s, educated woman. So she would have to pay for her own health insurance through New York State of Health. But she did not really comprehend what the variations were for the silver, the bronze, the gold, or the platinum plans that are available in the marketplace. So it really
I
came
didn't
down.
know about that either.
Right. So it really came down to like what her specific needs were, because then her monthly premium would be based on whichever plan she chose, the higher tier or the lower tier. In her case, she could have settled for the bronze tier and moved on, right? But she preferred not to really participate with generic drugs. She preferred like the brand name ones. So in order for her to get that, she needed a higher tiered plan, which she was willing to pay for a higher premium so she could get that on a monthly basis. But again, it's about connecting with our consumers, understanding what your specific needs are, and guiding you through the process.
Now, does this silver, gold, and platinum apply to people who are 65 and
No,
over?
no.
Okay, so that's for people.
Younger, yeah.
Right.
Yeah.
So in the 65 and over, there's a category, and it depends on who you choose and whether, like you pointed out, is your doctor covered? Are you going to the doctor frequently for orthopedic problems or all of the above?
I think like even, as I'm sitting here, as someone who, you could kind of, you're tech savvy, you can figure it out. But I think even with all those things, it's so important. I know for myself to like meet with a community. If I was in that situation, I know a lot of younger people, right, who were on their parents' insurance.
Yes,
And I
yes,
think that that's such a
yes.
common thing. It's like, and then you age out and you might not have a job, that's going to provide you with that. So now you're like, what do I do?
I know.
And it's expensive.
We just spoke with a 27-year-old teacher.
Right.
She is a substitute teacher. She got off of her parents' health insurance. Educated young woman, but just navigating the New York State of Health to kind of like figure out which plan worked best for me. Because when you think of someone in their in their mid to late 20s, you don't think of someone with a lot of chronic health issues. But there are some people that have underlying things that they're required to see some specialists more than others. And then based on that, you would kind of like say like, okay, then you might want to consider this option versus that option.
No, and I think that's, it's hard because you don't know these things, the average person. And I know a lot of, even people that I work with, their kids and stuff who have, aged out. It's such an expensive thing now. You're like, oh my gosh, like now I can't be on a family plan. Well, how do I do this? So I think it's so important for that aspect too, to really sit with someone and to get this tailored program for your needs.
Well, I think there's a large group, and that's not just the aged out, but there are people who are not working. Unfortunately. And you lose your job, you get laid off, and all of a sudden you're 50 years old.
Right, exactly.
And you need insurance. Is that something you will get involved
Absolutely.
with?
Absolutely.
So it's not just 65 and over.
No, but that's where our primary grant, that's our primary grant and our primary focus. But we will not say no to you. You come to us and you tell me that I need health insurance. Okay, let's talk.
I mean, to me, that's a major problem for people in a lot of age brackets. All of a sudden you're 55 years old, you got laid off, and now you got 10 years to go before you're on Medicare. I hear some bad stories about the costs of insurance during that time.
I mean, the truth is that there are options out there, right? It's just about like sitting down and working with someone to
Yeah, but
navigate
that's
what
a
it is.
very, to me, a very,
Yeah.
very valuable service,
Yeah.
which I will get to keep in my mind.
No, absolutely. And
Because,
I think that, and that's something to really, and that's why it's so important, organizations like yourself, because these things, when it comes to this world of insurance, it's so individual. And we even say that, when Medicare open enrollment comes, right? It's not like a blanket statement for everyone because your needs are so different from, your neighbor next door. So I mean, it's such a valuable asset to sit with someone and say, these are the things that I need. These are the health conditions I have. These are, even with that woman, that was such a great example, that she wanted, non-generic drugs,
Yeah.
so it's really so important. Like I think that in itself is just such a
well,
wonderful concept.
also, I think a big thing is to really evaluate the coverage with this plan. It may be less expensive, but maybe it's more expensive,
Right.
depending on,
Right.
Yeah.
the co-pays
Mhm.
or the whatevers. People, I think, get misled a lot of times.
They do it. I mean, so I've worked in healthcare prior to doing
Mhm.
this, and I see that there are some people that are younger than 65 but have chronic health issues that requires for them to see, just for example, it requires for them to see a neurologist, an endocrinologist, a psychologist, a psychiatrist, their
Right.
PCPs. So think about the co-payments that you would have for just your regular PCP, right?
Mhm.
And then you have the specialist co-payment.
Right.
Whereas if you had upfront chosen a higher value plan, you mightn't have the co-payment,
Right.
but at the end of the year, you may end up saving just because you're not paying for these co-payments or you're not paying deductibles because you're covering that already in your
Yeah,
monthly
I
premium.
mean, I found even with the Medicare part of it, the Medigap and Medi Advantage programs, you really have to be careful.
Yeah.
If you just look at the dollar sign, you could get taken in the long run big time,
Right.
you know.
Yeah.
So that to me is a great
Yeah.
area of
Absolutely.
advan Now, the other area that you get involved with heavily is Medicaid, um, which we've had a lot of people talk about. And the more we talk about it, the more confusing I find it personally. Uh,
So,
pointing fingers here, but there are people who try to encourage you to do certain things like get trusts and whatnot, so you can prepare yourself for Medicaid.
mhm.
Um, and yet you may not really be eligible for Medicaid.
Yeah.
So you're going through a whole hoop-de-doo. Um, and I guess my question to you is, what's the process as
Yeah.
far as Medicaid goes? Uh, and would that
Yeah,
be
because then you got community Medicaid. So yeah, walk us through
yeah,
those
like, is
two.
that for
Yeah.
any
Right.
age, or you focus primarily on 65 and over?
So, like you said, what if there's a gentleman that he's in his 50s and he's just suddenly become laid off,
Mhm.
Right.
right? Um, so we can help him to apply for health insurance. And in his case, and let's say he has very little resources and he doesn't have any income. We can help him to apply for Medicaid or community Medicaid, right? And he would qualify for that if his income meets the criteria.
Right.
Let's say that there's someone that um, is 55, has been deemed disabled, and it takes about 2 years after you've been deemed disabled for you to actually get Medicare coverage. It's not an automatic system. I'm disabled, the doctor deemed me disabled, so I'm now on Medicare. So for those consumers, they might need like home care assistance, right? So that's something we can help them with. So through a Medicaid application, we can help them to get home care. So a lot of folks might have more resources. By resources, we mean, money in the bank, or may have multiple properties or multiple vehicles that are counted as assets. So in those particular cases, it would be a little challenging for us to navigate a successful application for that individual, but there are ways around it. And this is where we would kind of tell them, we work with Toru Law Services. There are free law services that consult with seniors on Long Island. So we'll say to that consumer, we really can't tell you what to do. It's beyond our scope, but we would recommend that you meet with them and they can guide you on the steps necessary. Now, once they've met with them and if they've been guided by them that they could still move ahead with their application, they come back to us, we submit the application. This is where it kind of differs in terms of opinion and whether you should do this or not. Some folks are like, but I can, glaringly see that my income is over. I can glaringly see my resource levels are over. My position on that is submit the application, get the response from DSS, allow them to say to you that your resources are over by this much. So then the next steps, in my opinion, would be for you to speak to a trust company if that's something that you're desirous of doing, and let them know that this is the amount that you're over for, and then they'll help you to decide if you want to apply for a trust so that you can get Medicaid. But it's not something that I would just tell you to do.
Right.
Right.
There,
Well,
yeah.
see, there's a big thing here with you, all right?
Mm,
You're filing an application at no charge.
right.
There are other people who will charge a substantial amount of money, whether they be attorneys or just some firm that applies. They could be paying, 3,000, 4,000 or more
Or more.
to apply for Medicaid.
Mhm.
So the application part of it, when people don't know about your service,
Yeah, right.
becomes expensive. So I think one of the questions, first of all, I would go to you before I would do anything else. But what is considered income? And like if somebody wants to figure out their own, would I ever have a chance to be on Medicaid?
Mhm.
Like I see numbers, I forget, $1,800 if you're single,
Mhm.
and $2,433 if you're a couple per month.
Mhm.
So a lot of people are not going to fall into that category, fortunately, for a lot of people, all right? But what's counted as income? Like just
Yeah.
give me a rundown.
So, if you've retired and you have Social Security,
Right.
that's counted, right? If you have if you're receiving stock payout dividends, that's counted. If you have a life insurance policy that has cash value, that's counted.
Right. If
So,
you have an IRA,
yeah,
you're getting
yeah,
your
yes,
required
yeah,
minimum
Yeah.
yes,
distribution.
that's counted.
That's income.
Yeah,
If you have a pension,
yes, that's
that's
counted.
income.
Yeah.
So if you happen to be fortunate
Mm-hmm.
and paid, like I've been paying Social Security since I'm like 13 or 14 years old. That's a long time.
Yeah.
So I get a decent Social Security,
Mhm.
which almost kicks you out.
Yeah, but again, I
you
mean,
know?
I would still encourage you to submit the application, because then Medicaid will say, New York State Medicaid will say, based on your income, you qualify for, there's a way that you can pay the difference of what you're overqualified for to qualify for Medicaid, a spend down amount.
Right.
So then it'll be up to you to say,
Right, what your next steps?
yes.
So you file an application, like you're saying,
Mhm.
and you would get back something that says, okay, you could qualify for this part of Medicaid,
Yeah,
or you can't qualify.
right. Or it would say you're not eligible for Medicaid.
So you basically have nothing to lose
Nothing to lose,
Yeah.
especially if you haven't paid me.
doing it
Right.
via you.
Yeah,
I don't have to pay $4,000 to find that out,
no,
basically, which
no.
I know,
What's
pe-
like,
I
you
know
know-
people who have done.
Yeah,
You
but
know.
with something like that, you get, it says, okay, you're $1,000 over something.
Mhm.
And then you're like, you know what, I decided, going a trust might be a better thing. So then so you're just able to submit, once you do all that, to submit the application again.
So let's say you get the letter that says that you're over income and this is your spend down amount. It's up to you if you want to pay Medicaid that on a monthly basis to have the Medicaid insurance, or if you want to go to the route of getting a trust. Once you've set up the trust, you provide us a copy of that. We submit it to New York State Medicaid, and they'll reassess it then.
Oh, okay.
Yeah.
Now, the trust part would go through an attorney.
It would go through an attorney, or it could go through like a
Could
trust.
be,
Yeah.
like $7,000 is like the going rate for a trust.
Well, you know what? You'll have to do research on that one.
Yeah.
After the break, we will continue talking with Nirvaarni Mathoera, who is the Director of Health Insurance Programs at the Nassau-Suffolk Hospital Council. We're talking all things Medicaid, health insurance, enrollment assistance. You're listening to Project Independence and You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Lowe's, and we're jumping right back in with Nirvaarni Mathoera, who is the Director of Health Insurance Programs for the Nassau-Suffolk Hospital Council. We're talking about Medicaid and health insurance and really what a wonderful service this organization is. So before the break, we were just talking about Medicaid, and it's something that, has come up so many times on the show, and it gets so complicated. And can you just tell us quickly, a quick little blurb, what the difference is between community Medicaid and Medicaid, like
Sure.
other programs?
So there's really three versions of Medicaid, right? Community Medicaid is I just need to have health insurance to go to my doctor.
Mhm.
That's the way I think of community Medicaid. And then there's a second one that really is for folks that need long-term care out of a nursing home. So you think of like home care. You think of you need someone to come home and help you to navigate your daily functions. And then the other one that I think about is kind of like you're in a facility, you're in a nursing home. So those are the variations of Medicaid.
That's, yeah. Wow.
Now, if you have long-term care insurance, does that become an obstacle as far as Medicaid goes?
I'm really not sure.
Yeah.
Generally, we don't encounter those
Yeah.
consumers because they've kind of already been set up.
Right.
But it's
Right.
something that I can look into.
Yeah, because I mean, you've been paying a premium for that. So my feeling would be you shouldn't be penalized for that because you've been paying out of pocket. But then again, I don't know the rules.
Yeah, I think if you're paying, like I'm just spinning here, right? If you're paying for that, then you have the resource to pay
Right,
for
exactly,
it.
right.
Yeah, I
Yeah.
mean, and that's another topic.
That's a choice,
Yeah,
right?
right.
Yeah.
I mean,
Yeah.
I've learned that
Yeah.
long-term care insurance, there's 6 magic questions and you have to say no to the 6 questions,
Okay.
to 2 of the questions
Okay.
before you can get any money.
Got it.
Can you feed yourself? Can you get out of bed yourself? Can you wash yourself? And if you basically, maybe you have dementia issues that still allow you to do that, that you're not going to get long-term care insurance.
Interesting.
Because I found that it is interesting.
Interesting.
And I tell young people to make sure when you look into long-term care insurance, you look into a lot of the little details that go into it.
Yeah, that's like the unicorn of the world today, I feel like in healthcare. Like if someone has long-term care insurance,
Right,
like
because most people
Yeah.
aren't
Yeah, you
doing that
figure
too
you're
much
going to be
anymore.
covered,
Yeah,
all right?
yeah.
Well, yeah, you'll be
Yeah.
covered, but you better have no answers to 2 of these 6 questions that they all ask.
Yeah.
So like 6 golden questions.
There you go. Hot tips from Otto.
Yeah.
Now, do you have people, like, if you that speak other languages that can assist in, this kind of process?
Absolutely. So my team are bilingual. They speak Spanish and English. And for the other languages that we aren't capable with, we have an interpretation services that we utilize.
Okay.
Right.
Yeah.
Yeah, because I could have, you add that to all this, right?
Well,
That
I
you
mean,
don't speak the language.
Yeah.
So, I mean, how it's even more difficult to navigate this process.
And North Hempstead has a lot of languages.
Yeah, well, that's what literally popped into my head. It's a very,
like a UN.
yeah, right.
Yeah.
No, that's very true. So I think that, it's something that could be so helpful that someone could actually walk you through this.
Yeah. The one thing that I also wanted to mention, which I hadn't already, is that sometimes we have consumers that we're working with that are homebound. In an ideal world, we should be able to make home visits, but unfortunately, we're not able to do that. But there's,
that was a question I
Yeah.
actually I'm so glad you
Yeah.
brought that up.
But there are still ways that we
Yeah.
can work with that consumer. So we have this one particular individual. She's homebound. She's an oxygen tank. Like coming out is very challenging. So we can send her the documentation that she needs, and she can sign it where that she's giving us authorization to work on the application on her behalf, and we can do that.
Okay.
Or if she had a neighbor, a daughter, a son, a relative that she wanted to assign to
Right.
complete the application on her behalf, we can do that as well.
Yeah, I saw something in here somewhere, if you have, if you can't,
Mhm.
if you authorize somebody else to
Yes.
do it for you.
Yes,
There was a term I saw, waiver services.
waiver services.
Yeah, what is waiver
So for
services?
folks that are, I think that refers to OPWDD. So this is for individuals that are disabled. So
Okay,
there's a waiver that you can apply for to get them on Medicaid. I think a bit more expeditiously compared to non-disabled individuals.
okay,
Yeah.
okay.
Yeah, I just think that and I just want to remind people that in case you missed it and grab your pens, the best phone number to reach them at is 631-435-3000. And you guys, it looks like you're Monday through Friday, 9 a.m. to 5 p.m.
Absolutely.
Great.
Yeah, and I did want to say that we currently are at 48 public sites across Nassau and Suffolk counties. We do have a calendar on site, so if you go in at a particular day, you can see which sites we're at. And we also provide appointments in our office at our Hop Hog location.
Right.
So it's not the case where you have to go to our public sites.
Oh, okay.
Yeah.
Now, for the public sites, do you have to make an appointment?
No, they're walk-in
Oh, they're
services.
walking. Okay, that's
So
great.
we're typically at sites for about 3 to 4 hours, and it's in a private space because we do have to comply with HIPAA regulations. So all interviews are done in a private space.
Great.
Now, public sites are like,
Libraries, we're in a lot of libraries across Long Island.
right,
We are also in Long Island Cares, Long Island Center for Independent
so this is
Living.
like a moving
Yeah,
public site, like
yes.
you might be in Great Neck or Hop Hog.
And
or-
we try to stay consistent. So, for
Right.
example, if we go to Hop Hog Library, I know we're in Hop Hog Library on the fourth Wednesday of every month.
Okay, so it's like a standard.
Yeah. And we have sites that were there sometimes 10 a.m. to 2 p.m. or sometimes 4 p.m. to 8 p.m. because we do take into consideration there are some consumers that rely upon someone else for a ride.
Mm-hmm.
Yeah.
So somebody could go to one of these sites and actually have an in-person consultation,
Absolutely.
right,
Yeah.
at
Do
no
you
cost.
recommend if someone goes to these, walk-in things, if they should be bringing anything with them? Like, what if for the initial thing? I know you said like there's probably a bunch of
Yeah.
follow-up things, but is there something that they should bring with
So our
them?
process is generally when the consumer calls us, we have a front desk worker. She's really great. She's bilingual. She'll speak with them and kind of understand where they're located. I'm in Port Washington, for example, and she'll tell them we're going to be at Port Washington Library on this specific day, or if they're not able to make it to that one, the neighboring locations. And then she'll send them an email with our checklist.
Right.
So they can kind of review to see what documentation they should be
Oh, that's
bringing.
great, yeah.
If it's a complicated checklist, I'll be frank.
Yeah.
If they have questions again, call me. I'll tell you. I'll tell you what to bring with
I like
you.
I like the
Yeah.
honesty though.
Yeah.
That's good.
Yeah,
Is
tell
this checklist something that you could get, like via website or?
I'm not sure if we have it on our website because it updates
No, I didn't
frequently.
see it on the
Yeah, it
website.
updates frequently, so we generally provide it to our consumers once they reach out to us. They come with the documents to the site, so we can process the application there and then for you. We submit it to LDSS, we get a response, or if we need supporting documentation, we work with you to submit that, and then hopefully we're friends for life. So, yeah.
No, that's great. That's really, I think that's, and I like the idea that it's these kind of walk-in things because I find too, working with the senior population, a lot of times that's good because, it's based upon you're not stuck to a certain appointment and you can kind of get a feel. It
Yeah.
takes a little bit of pressure off, I find.
Yeah.
But
a
I
lot of
do have a
times.
question as
Oh,
far
go
as that
ahead.
goes, all
Yeah.
right? When you walk in, how many people would you have there? Like
Good
suppose,
point, right?
5 of us walk in.
Yeah.
Now how long might you sit there? Is what
No,
what
that's a
sits
good-
in the
yeah.
back of
Yeah.
my head.
In an ideal world, I would love to schedule appointments,
Yeah.
right?
Okay,
Right. But I don't feel like it's the best use of our resources.
Yeah.
Right. So we've had instances where our enrollers are at a site and no one shows up. And then we've had instances where 9 people show up. So we ask for patience and we ask for understanding that we are going to get to you and we're going to provide you with the best service that we
yeah,
can.
I mean, if you're gonna be a walk-in, you're
Yeah.
liable to sit and
Yeah.
wait a little bit, so be
Yes.
prepared, bring a book,
Yes.
look at your phone, do
Absolutely.
whatever you want to do.
Yeah, we will get to you. We
Yeah,
will,
but
we will
yeah,
work with
point
you.
being, be
Yes.
realistic
Absolutely.
about the fact that if you do walk in, you're not gonna walk right in and knock
Yeah.
and sit there and talk to somebody.
Right. And then for
You might,
consumers,
but you might not.
right. And for consumers that have a very short window of time to work with, they might be the ones that might be best served in our office
Right,
because we honor that time very diligently.
right,
Yeah.
okay.
Yeah.
And even though Hop Hog might be a half hour or so from North Hempstead,
Mhm.
depending on where you live in North Hempstead,
Yeah.
it might be worth the trip, I would say.
Yeah. Yeah, I agree.
Definitely.
But I think too, what's nice, especially what you were saying with, that you try to kind of keep it consistent. So like, let's say, it's at the first of every month you're here. I think that gives you enough time that, it's probably, you won't be waiting so long because like, you're always at this library
Mhm.
at a certain time or something. So
Yeah, and we tell our consumers too when we speak with them on the phone, it is a walk-in process.
Yeah.
So to your point, Otto, like we try to give them like, guidance so that they're not frustrated. And we get it, people's time are precious.
Mhm.
Yeah, I
So,
mean, I think if
yeah.
people understand up front, but as you well know, there are some people that may not be quite so patient.
Yeah.
But what we always try to remind those people is that it's a free service,
Yeah.
and I think that
Yeah.
that's the key that
Yes.
everyone
Yeah.
should always
Yeah.
remember and should give you a little patience.
Yeah.
You're doing it because I know even for our programs that all
Yes.
tend to be free.
Otto, you said that you've encountered someone that paid out of pocket for services similar to us, and you quoted, I think, $4,000.
Yeah, these are real numbers.
Yeah.
I'm not making
Yeah.
them
A
up.
friend of mine
Yeah.
expressed similar experience, but
Mhm.
4 times the amount that you quoted to me.
Oh,
Oh
really?
my
Yeah.
God.
So the services that you would have to pay for out there, it's a lot.
Yeah.
I mean, I'm not
Yeah.
knocking attorneys, but
Yeah. No, we're not.
a lot of times people say, well, you have to really use an attorney. But what we're saying is there is an option to an attorney. If you have an attorney you're comfortable with and it's not a problem, good, but this is an alternative, which wouldn't cost you anything.
Right. I think the benefit to the attorney is kind of like a one-stop shop, right? In the sense
Right.
that
And I think
Yeah, I
that
mean-
that's
Yes.
where that definitely
Yeah.
occurs.
Yeah, I
Like-
mean, if you're doing your
Right.
will,
Right.
care
Right.
process,
You're kind of doing
else is
everything in
Yeah.
one
part
time,
of it.
right.
yeah.
And you're comfortable with your
Right.
attorney, that's fine.
Yeah.
Go for it.
But if you've got you're patient and you've got the time and you're able to kind of gather your documentation and you're willing to work with us, we're willing to work with you.
Right.
Yeah, that's
And that
really good.
checklist will tell you the documentation to gather.
Mm-hmm.
Okay.
Yeah.
And I think that that's anyone listening should know, what we always say is, everyone, and especially when you're a senior and stuff, and, you're like, it's overwhelming the process. You're not sure like what you need sometimes or like what would be best for you. And you just need help. And I think that that's an important thing is that you don't have to go and saying, what, I'm coming in because I need you to get me on this, it's just to talk it out with someone
Right.
that knows.
I had a consumer called me a few days before Christmas. Never met her, don't know her, have never seen her. She's screaming over the phone.
Yeah.
I have to go to my doctor's appointment. Medicaid transportation said they're not picking me up because I don't have insurance. I've got X, Y, and Z medical conditions. I need medication. I need to see my doctor. What am I going to do? I swear to you, I looked at my phone and it said 17 minutes of her sharing her story because it's
You're
important.
overwhelmed. You're
It's
just overwhelmed.
It's important to hear. It's important to listen. And I knew nothing of what to do in this particular case,
Yeah.
except that literally, and this part was so challenging for her, have her gather her documents that she'd received in the mail that she had not opened and looked at, take pictures of them, email them to me for us to look at them to understand where she was, what the problem was. Turns out she'd never gotten the recertification notice for her Medicaid, so she had no services. Now we know that December and during the holidays is one of the hardest times for seniors that live by themselves, as well as for those individuals that have mental health issues. So this was a very concerning case. But, because we are community health advocates and because we're enrollers, we were able to really work with our local DSS, work with her doctors to really expedite her insurance process. And this was not of anyone's fault. It's just her mailman unfortunately changed. The packages weren't delivered on a timely fashion, so she lost her services.
Oh God.
Well, you said some magic words there too, recertification.
Yes.
In
Yeah.
other words, this is not like a lifetime
No.
deal. How often do you have
Annually.
annually?
Yes.
So every year,
Mhm.
is it the same process?
No, the recertification process is very similar. There are very little documentation that you need to submit. You get a package in the mail,
Right,
and my recommendation is call us once you've gotten it.
right.
We can help you to do it, and it requires a meeting for no more than 15 minutes for us to complete it and send it out.
So when somebody gets certified for Medicaid, they should be aware up front that this is not a lifetime
Correct.
guarantee here.
And I think this is a discrepancy too, because during the public health emergencies, we weren't doing recertification because the world was just topsy-turvy,
Yeah.
right?
Yeah,
Right.
I actually remember that.
Right.
Yeah.
And then suddenly people were being made aware my services have been terminated just because it wasn't the practice that they were used to.
Right.
But
Right.
yes, annually we do Medicaid recertification.
Okay.
Yeah, wow. That's
I'll tell you, just talking to you on the show here has
I know. Otto's ready to go out and spread the word. But I think that, that's what's so important, and as you were saying, that there are a lot of organizations that do this, but I think, you guys are making an active, point to get out there and spread the word about all these services because, even just preparing, we learn so much and oh my God, they do this. I didn't think that it might be something like that. And I think, when it comes to health insurance for people, it's so overwhelming. It's so scary because you're seeing these huge numbers and especially when you're getting these bills and things that you're like, it's overwhelming. And I can imagine the phone calls that you guys get of people just in panic,
Right.
and in crisis mode, frankly. So it's really, I think, such a huge service. And I encourage anyone, who is listening to certainly
And
reach out.
our team members are very experienced. They're very empathetic and they're patient. So I do encourage, I can't say more about my colleagues. They're very well able to help consumers navigate this complicated matter.
This has been very important information, frankly, for myself, because I know people who have been in these boats, lose a job,
Yeah.
30 years old, all of a sudden, a grandson needs to get insurance.
Right.
Some guidance not from me, because I don't know enough. I know enough to be dangerous. And that's not good.
The one other thing that I wanted to kind of mention before we wrap up is that in addition to helping consumers with their Medicaid health insurance and their marketplace health insurance applications, we also help seniors with their Medicaid savings plan application.
Okay.
So this is called an MSP. So what this is that if someone has Medicare, sometimes they have to pay for their Part B Medicare. So we can help them to apply for an assistantship program where they don't have to pay that premium.
Right.
Oh, yeah. Yeah. I mean, look, there's so many layers. I think just from, having you on here, and it just shows how complicated and how it's so beneficial to really talk it out. And it's so personal. And that's what I just can't stress enough. These are not something that you could just make a blanket statement and say, this is good for everyone. That's why talking to an advocate and really working through your needs and, which vary is so important. And once again, that phone number is 631-435-3000. So please reach out because it's certainly a service. And thank you so much. It was just, we are just blown away by everything. We will certainly spread the word. So thank you, Nirvaarni Mathoera from the Nassau-Suffolk Hospital Council, Health Insurance Enrollment Assistance, for such great information that you gave us. You're listening to Project Independence and You on LIU Public Radio.